ever pondered on how to determine your most fertile days without an ovulation test? Well, the answer may lie in a method developed back in 1953 by an Australian doctor named John Billings. This method, known as the Billings Ovulation method, or BOM, is based on observing changes in cervical mucus or vaginal discharge throughout your cycle. Intriguing, isn't it? So, how does it work? The Billings Ovulation method is broken down into distinct phases. The first phase begins with menstruation and extends for a few days after. During this time, your discharge is thick, cloudy, acidic, and tough. This mucus texture is a deterrent for sperm cells, making it difficult for them to pass through. Even if they manage to penetrate, the acidity is likely to hinder their survival. This period, as per the BOM, is referred to as the infertile basic pattern. You may also notice a sense of dryness around your labia during this phase. As your cycle progresses, so does the nature of your discharge. As ovulation approaches, your mucus transforms. It becomes clearer, more elastic, and fluid, similar to raw egg whites. This mucus is significantly more hospitable to sperm cells, allowing them to penetrate and swim towards the cervix. Then, we reach the peak. This is the moment around your ovulation. The cervical mucus is transparent and extremely slippery, and the entrance to your vagina may be swollen. The mature egg that is released remains viable for 12 to 24 hours before it can be fertilized. Following the peak, the mucus tends to become flaky or sticky, or it may disappear completely. Your fertile period occurs a few days before the peak, in phase 2, and lasts until 2 to 3 days afterwards. This is when you have the highest chance of becoming pregnant. So, the Billings ovulation method is a natural, non-invasive way to understand your fertility. It's a method that empowers you to be in tune with your body, understanding its signals and rhythms. It's about observing, understanding, and interpreting the changes in your cervical mucus to gauge your fertility. Remember, each person's body is unique, and individual experiences may vary. The Billings ovulation method is one of many tools available for understanding and navigating your fertility. It's always best to consult with a healthcare provider for personalized advice and information. But isn't it fascinating to consider how much our bodies can tell us if we just take the time to listen?